Caring is central to nursing practice. The increasing use of technological advances for rapid diagnosis and treatment often causes nurses and other healthcare providers to perceive the patient relationship as less important. However, it is important to preserve a relationship-centered approach to patient care for all aspects of nursing. The American Organization of Nurse Executives describes caring and knowledge as the core of nursing, with caring being a key component of what a nurse brings to a patient experience. As we go through the chapter, look for ways that these principles align with other perspectives and philosophies of nursing care, shown as Figure 7.1. The American Organization of Nursing Executives Guiding Principles for Future Care Delivery. Theoretical views on caring. Caring is a universal phenomenon influencing the ways in which people think, feel, and behave in relation to one another. Since Florence Nightingale, nurses have studied caring from a variety of philosophical and ethical perspectives. A number of nursing scholars have developed theories on caring because of its importance to nursing practice. After listening to staff nurses' stories and analyzing their meaning, Patricia Benner described the essence of excellent nursing practice as caring. Caring means that people, events, projects, and things matter to people. Caring is always specific and relational for each nurse-patient encounter. This is especially important because all patients are different, and each patient has his or her own background, values, and cultural perspectives. Develop a caring relationship with your patients and listen to their stories to fully understand the meaning and impact of their condition. This information and understanding helps you provide individualized patient-centered care. In 1978, Madeleine Leninger studied caring from a transcultural perspective. Then in 1991, Leninger stresses the importance of nurses understanding cultural caring behaviors. Even though human caring is a universal phenomenon, the expressions, processes, and patterns of caring vary among people of different cultures. For caring to be effective, nurses need to learn culturally specific behaviors and words that reflect human caring in different cultures to identify and meet the needs of all patients. Please review Box 7.1, Cultural Aspects of Care, Nurse Caring Behaviors, as a supplement to this PowerPoint. Case Study. Mrs. Levine is an 82-year-old patient diagnosed 2 months ago with lymphoma, a cancer of the lymph tissue. She has been experiencing weakness and fatigue. Over the past 4 weeks, she has lost 8 pounds. Mrs. Levine had been relatively independent before her diagnosis, playing bridge each week with friends and going to lunch with fellow church members. But now she has much less energy to do the things she enjoys. What do you see will be the challenges for Mrs. Levine? Due to her diagnosis of cancer and possible side effects of treatment, Mrs. Levine may not be able to maintain her previous level of independence. This could also impact her activities of daily living or ADLs. According to Watson, caring becomes almost spiritual. A nurse communicates caring healing to a patient through the nurse's consciousness. This takes place during a single caring moment between nurse and patient when a connection forms. The model is transformative because the relationship influences both the nurse and the patient for better or for worse. Caring healing consciousness promotes healing. The theory provides direction for how to develop useful and effective caring strategies appropriate for multiple age group and healthcare settings. Swanson defines caring as a nurturing way of relating to an individual. Swanson states that caring is a central nursing phenomenon but is not necessarily unique to nursing practice. Swanson's model includes 5 caring processes: 1. Knowing, 2. Being with, 3. Doing for, 4. Enabling, and 5. Maintaining belief. Please review Table 7.1, Watson's 10 Curative Factors, Box 7.2, Evidence-Based Practice, Enhanced Caring, and Table 7.2, Swanson's Theory of Caring, as a supplement to this PowerPoint. Nursing caring theories have common themes. Duffy et al. Identified these commonalities as human interaction or communication, mutuality, appreciating the uniqueness of individuals, and improving the welfare of patients and their families. The nurse and the patient enter into a relationship that is much more than one person simply doing tasks for another. There is a mutual give and take that develops as nurse and patient begin to know and care for one another. When a nurse and patient enter a relationship of respect, concern, and support, caring can seem invisible. The nurse's empathy and compassion become a natural part of every patient encounter. However, when caring is absent, it becomes very obvious. Patients can tell when nurses fail to relate to them. As you practice caring, your patient will sense your commitment and willingness to enter into a relationship that allows you to understand the patient's experience of illness. One aspect of caring is enabling. When a nurse and patient work together to identify alternatives and approaches to care and resources. Another common theme of caring is to understand the context of a person's life and illness. It is difficult to show caring for another individual without gaining an understanding of who the person is, and his or her perception of the illness. This approach is more successful than simply selecting interventions on the basis of your patient's symptoms or disease process. Case study continued. Mrs. Levine's son, Jim, resides only a few miles away and is a consistent resource when she needs transportation to the physician or trips to the grocery store. She will begin a research protocol for chemotherapy treatments this week at the oncology clinic. How important do you think Jim's relationship and interaction with his mother will be in the weeks to come? Patient's perspective of caring. Researchers have explored nurse caring behaviors as perceived by patients. Their findings emphasize what patients expect from their caregivers and are useful guidelines for your practice. The study of patients' perceptions is important because healthcare is placing greater emphasis on patient satisfaction. Patient satisfaction with nursing care is an important factor in a patient's decision to return to a specific healthcare facility. When patients sense that healthcare providers are sensitive, sympathetic, compassionate, and interested in them as people, they usually become active partners in the plan of care. As you begin clinical practice, consider how patients perceive caring and the best approaches to provide care. Behaviors associated with caring offer an excellent starting point. It is also important to determine an individual patient's perceptions and unique expectations. Frequently, patients and nurses differ in their perceptions of caring. For that reason, focus on building a relationship that allows you to learn what is important to your patients. Knowing your patients helps you select caring approaches that are most appropriate to their needs. Please review Table 7.3, Comparison of Research Studies Exploring Nurse Caring Behaviors as a supplement to this PowerPoint. Ethics of care. When we care for others, we preserve their dignity. The term ethic refers to the ideals of right and wrong behavior. An ethic of care is concerned with relationships between people and with a nurse's character and attitude toward others. Nurses who function from an ethic of care are sensitive to unequal relationships that led to an abuse of one person's power over another, intentional or otherwise. An ethic of care places the nurse as the patient's advocate, solving ethical dilemmas by attending to relationships and giving priority to each patient's unique personhood. Why are nurses and patients often in unequal relationships? In healthcare settings, patients and families are often on unequal footing with professionals because of the patient's illness, lack of information, regression caused by pain and suffering, and unfamiliar circumstances. Case study continued. Sue is a nurse who has worked in the oncology clinic for more than 10 years. She enters the examination room where Mrs. Levine is waiting, introduces herself, and sits down next to her patient. Sue states, "Mrs. Levine, I am here to understand your story. I want to listen and learn how I can best help you." Sue uses eye contact while talking and leans toward Mrs. Levine to establish a physical presence. Mrs. Levine nods, smiles, and begins her story. Caring in nursing practice. It is impossible to prescribe ways that guarantee whether or when a nurse becomes a caring professional. Experts disagree as to whether caring is teachable or more fundamentally a way of being in the world. For those who find caring a normal part of their lives, it is a product of their culture, values, experiences, and relationships with others. People who do not experience care in their lives often find it difficult to act in caring ways. We learn from our patients. Our patients tell us that a simple touch, a simple phrase, or a promise to remain at the bedside represents caring and compassion. As nurses, it is important to assess both your caring needs and your caring behaviors. You cannot give fully engaged, compassionate care when you feel depleted or uncared for. Take time to recognize stressors and reach out to colleagues and family and friends for help in coping with these stressors. Whether you are giving or receiving care, the value of caring in your nursing practice benefits your patients, your colleagues, and your healthcare agency. Providing presence. Providing presence is a person-to-person encounter conveying a closeness and sense of caring. Presence involves being there and being with. Being there is not only a physical presence, it also includes communication and understanding. Nursing presence is the connectedness between the nurse and the patient. The outcomes of nursing presence include alleviating suffering, decreasing a sense of isolation and vulnerability, and personal growth. It is especially important to establish presence and caring when patients are experiencing stressful events or situations. A nurse's presence helps to calm anxiety and fear. Mrs. Levine explains, "I have had a good life. I just don't know what is going to happen. The doctor tells me the cancer is serious. I worry about what is going to happen to me and how it will affect my son. I do not want to become a burden to him." Sue responds in a calm, soothing tone, "Mrs. Levine, your concerns are very normal. It is important for you to remain as independent as possible. Let's talk about how we can do that." Name 3 things that Sue has said or done in this initial meeting that indicate how her nursing care will be a positive and integral part of Mrs. Levine's care. Sue's presence is not only physical, but includes communication and conveys understanding. Her tone of voice is soothing and calm, which helps to decrease Mrs. Levine's anxiety. Sue listens to Mrs. Levine's concerns and has a positive and encouraging attitude. Touch is relational and leads to a connection between nurse and patient. It involves contact and non-contact touch. Contact touch involves obvious skin-to-skin contact, whereas non-contact touch refers to eye contact. Before implementing touch, be aware of your patient's cultural practices and past experiences. For some people, a simple touch on the arm may be perceived as invasive, and for victims of abuse, a simple touch may be perceived as a threat. Nurses use task-oriented touch when performing a task or procedure. Caring touch is expressed in the way you hold a patient's hand, give a back massage, gently position a patient, or participate in a conversation. Protective touch is a form of touch that protects the nurse and/or patient. The most obvious form of protective touch is preventing an accident. Because touch conveys many messages, use it with discretion. Know and understand if patients accept touch and how they interpret your intentions. Time for a quick quiz. A female patient has just found a large lump in her breast. The physician needs to perform a breast biopsy. The nurse helps the patient into the proper position and offers support during the biopsy. The nurse is demonstrating A. Enabling, B. Comforting, C. A sense of presence, or D. Maintaining belief. The answer is C. Providing presence is a person-to-person encounter conveying a closeness and sense of caring. Presence involves being there and being with. Case study continued. Mrs. Levine has consistently relied on her son, Jim, to provide caregiving support by assisting with transportation and being a day-to-day resource. Jim brings his mother to the outpatient oncology clinic for her first chemotherapy infusion. The total treatment will last for approximately 5 hours. Sue invites Jim to sit in the treatment area with his mother. Can you think of some ways that Sue can demonstrate to Jim her caring for Mrs. Levine? Listening is not only taking in what a patient says, it also includes interpreting and understanding what the patient is saying, and conveying back that understanding. Caring through listening enables you to become a participant in the patient's life. To listen effectively, you need to silence yourself and listen with openness. It is important to remain intentionally silent and concentrate on what the patient has to say. Give patients your full, focused attention as they tell their stories. Through active listening, you begin to truly know your patients and what is important to them. In Chapter 24, we will take a more in-depth look at the communication process. One of the 5 caring processes described by Swanson is knowing the patient. Knowing the patient is composed of both the nurse's understanding of a specific patient and the subsequent selection of interventions. It occurs over time and is essential when providing patient-centered care. To know a patient means that the nurse avoids assumptions, focuses on the patient, and engages in a caring relationship with the patient that reveals information and cues that facilitate critical thinking and clinical judgments. Aspects of knowing include responses to therapy, routines, and habits, coping resources, and physical capacities and endurance. The most important thing for a beginning nurse to recognize is that knowing a patient is more than simply gathering data about the patient's clinical signs and condition. Success in knowing the patient lies in the relationship you establish. Case study continued. Outside of the treatment room, Jim asks, "How will my mother respond to this chemotherapy? What should we be expecting?" Based on Swanson's theory of caring, what are the subdimensions for maintaining belief that Sue must convey? Sue's response should convey believing in holding in esteem, maintaining a hope-filled attitude, offering realistic optimism, and going the distance. Spiritual health is achieved when a person can find a balance between his life values, goals, and belief systems and those of others. Spirituality offers a sense of interpersonal, and transpersonal connectedness. An intra-personal relationship is when persons are connected to themselves. An interpersonal relationship exists when one is connected with others and the environment. A transpersonal relationship exists when one is connected with God, an unseen force, or a higher power. To assist in relieving symptoms and suffering include the following: performing caring nursing actions that give a patient comfort, dignity, respect, and peace, providing necessary comfort and support measures to the family or significant others, creating a physical patient care environment that soothes and heals the mind, body, and spirit, comforting through a listening, non-judgmental, caring presence. Always be aware of your patient's environment, assess symptoms thoroughly, and take the necessary steps to make the environment comfortable. Through a skillful and accurate assessment of a patient's level and type of pain or other symptoms, you are able to design patient-centered care to improve the patient's level of comfort, often conveying a quiet, caring presence. Touching a patient or listening helps you to assess and understand the meaning of your patient's discomfort. The caring presence helps you and your patient design goals for symptom relief. Human suffering is multifaceted, affecting a patient physically, emotionally, socially, and spiritually. It also affects a patient's family and friends. A caring listener comforts patients and their families. Family care. People experience life through relationships with others. Caring does not occur in isolation from a patient's family. Family is an important resource. Success with nursing interventions often depends on the family's willingness to share information about the patient, their acceptance and understanding of therapies, whether the interventions fit with their daily practices, and whether they support and deliver the therapies recommended. Learn who makes up the patient's family and their roles in the patient's life. Showing the family that you care for and are concerned about the patient creates an openness that then enables a relationship to form with the family. Caring for the family takes into consideration the context of the patient's illness and the stress it imposes on all members. Please review Box 7.3, Nurse Caring Behaviors as Perceived by Families, as a supplement to this PowerPoint. Case study continued. 3 hours into the infusion, Mrs. Levine asks Sue for a glass of water and begins to talk about her pet cat and her desire to return home and be able to visit with one of her bridge partners tomorrow. Sue has another patient down the hall who has an infusion that has been underway for about an hour. What should Sue do to show her caring for Mrs. Levine? In a respectful tone and in a caring manner, Sue should let Mrs. Levine know that she will be back shortly to check on her as she has another patient who requires care. Caring is the heart of a nurse's ability to work with people in a respectful and therapeutic way. Caring is specific and relational for each nurse-patient encounter. For caring to achieve cure, nurses need to learn culturally specific behaviors and words that reflect human caring in different cultures. Because illness is the human experience of loss or dysfunction, any treatment or intervention given without consideration of its meaning to the individual is likely to be worthless. Caring involves a mutual give and take that develops as nurse and patient begin to know and care for one another. It is difficult to show caring to individuals without gaining an understanding of who they are and what is their perception of their illness. Presence involves a person-to-person encounter that conveys closeness and a sense of caring that involves being there and being with patients. Time for a quick quiz. When a nurse enters a patient's room and says good morning before starting care, the nurse combines nursing tasks and conversation. An important aspect of care for the nurse to remember is the need to A. Establish a relationship, B. Gather assessment data, C. Treat discomforts quickly, or D. Assess the patient's emotional needs. The answer is D. In Swanson's theory of caring, being with is being emotionally present for another person. By taking the time to assess the patient's emotional needs, the nurse is exhibiting caring behavior. The challenge of caring. Today's healthcare system presents many challenges for the nurse to provide a caring patient-centered plan of care. Nurses are often torn between the human caring model and the task-oriented biomedical model and institutional demands that consume their practice. Nurses have increasingly less time to spend with patients, making it much harder to know who the patients are. A reliance on technology and cost-effective healthcare strategies and efforts to standardize and refine work processes all undermine the nature of caring. If healthcare is to make a positive difference in patients' lives, healthcare must become more holistic and humanistic. Nurses play an important role in making caring an integral part of healthcare delivery. This begins by making it a part of the philosophy and environment in the workplace. Incorporating caring concepts into standards of nursing practice establishes the guidelines for professional conduct. Finally, during day-to-day practice with patients and families, nurses need to be committed to caring and willing to establish the relationships necessary for personal, competent, compassionate, and meaningful nursing care.